Hey everyone, this is a mini lecture on steroids. We'll talk about the two different types of steroids. And before we get into that, there is an important hormone in the body that is relevant to our discussion of steroids, and that's testosterone. So this is a hormone that's primarily found in males. It it is found in women, but in just smaller amounts than it is in men typically. Testosterone plays a really important role in fetal development. So it is actually the presence of testosterone that differentiates the genitalia of the fetus into male genitals. And without testosterone, all baby fetuses will default into developing female genitalia. There's also some evidence that testosterone plays a role in some differentiation of different brain functions, but that evidence is somewhat limited. It has a much greater role in puberty, where testosterone leads to the sort of masculinization effects in boys, rapid growth in height, lowering of the voice, hair growth in the face and on the body, the development and descent of testicles and the genitals, and also muscle growth. And so we'll be talking about steroids in this chapter, and one type of steroids are synthetic versions of testosterone. So they're created in a lab, and they're called anabolic steroids. Um, so another type of steroid is a corticosteroid. And this is a steroid that's taken for inflammation and for asthma. And it's not a synthetic version of testosterone. It's actually from cortisol, which is a substance in the body that's responsible for the kind of stress response that we experience. So cortisol prevents the immune system from causing inflammation, and it really kind of slows down the immune response so that it limits this inflammation or sending of red blood cells to injury or allergic reaction. And so corticosteroids can treat things like asthma, arthritis, COPD, uh, skin diseases, allergic reactions. It really has a wide range of uses uh, in a medical sense. And then jumping back, so now anabolic steroids of the synthetic version of testosterone. So testosterone promotes muscle growth, and anabolic steroids increase the release of testosterone, and also suppresses cortisol, which is a substance that also breaks down muscles. So this not only builds muscle, but it also suppresses a substance that breaks down muscle. Nearly all anabolic steroids are Schedule 3, meaning they have some medical uses. So for men who don't naturally produce enough testosterone, for people who are burned and need to regrow tissue, and also for trans folks who are seeking gender affirming therapy, anabolic steroids are all medically indicated in those cases. Um, However, there are people who are using anabolic steroids without medical prescriptions for them, namely often athletes. And their use by athletes can follow really complicated regimens. And some of those languages like cycling or stacking or pyramiding and plateauing. But generally, it's stacking would be using multiple different types of anabolic steroids for somewhere between 4 to 18 weeks, and then sort of starting slow and then increasing the amount slowly. If they take weeks on and weeks off, that would be cycling through the use of steroids. Um, and when used in this way, the amounts taken can range from 10 to 100 times greater than what is used in a medical context. So people are taking a lot more of the substance if they're using it for recreational or for like performance enhancing purposes. So there are some dangers of using steroids in this way. For males, steroids can have a feminizing effect. So gynecomastia, which is the development of breast tissue among men. Also, testicles can become smaller and it can lead to infertility. There's some evidence and examples of roid rage or irritability, being more volatile, more reactive. But the scientific evidence is unclear on this. But it is a very commonly accepted anecdotal experience for men who take steroids. For women, the use of steroids can lead to irreversible physical changes. So developing more masculine characteristics, having extra muscle deposits, deeper voice, facial hair, male pattern baldness, enlarged clitoris. Again, remembering that testosterone plays a role in fetal development. That's something that can occur when adult women are using it. And losing the protective benefits of estrogen that estrogen provides on the way the heart functions. So there are some serious changes that occur that don't go away with stopping the use of steroids. There also is the risk for developing infertility in women as well, and the experience of amenorrhea or lacking a menstrual cycle. For anyone who takes steroids, this can increase the risk of heart disease and heart attack. It can cause damage to the liver and kidneys, which can be fatal. But these hazards are reversible. So once someone stops using steroids, their liver and their kidneys can recover from the damage that's been done to them. In adolescence, the use of steroids can build muscle mass, but it also leads to an overall growth reduction. So it stunts growth overall because it suppresses the growth hormone. And then for folks who stop using steroids, they can have this kind of rebound depression effect from the way the body responds to not having the substance in the body anymore. So steroids are used generally when they're used for non-medical purposes to enhance performance. And the question arises is whether or not these are addictive. People are not using them for some kind of experience of euphoria. They're using them for a performance enhancing effect. So they can be addictive, but not in the same way as other substances that we've talked about. And so we know that there can be withdrawal symptoms, fatigue, depression, loss of appetite, insomnia, and headaches. And we do know that some people can continue to take these steroids despite negative health consequences and despite other consequences, perhaps to their relationships that they're experiencing. But we also know that they're not getting high when they're taking them, and that there isn't necessarily a tolerance that develops to these substances. Again, though, people can become reliant on them and use them compulsively and feel like they have a hard time stopping their use. So it's really a tricky question about whether or not they're addictive. Hey everyone, this is a mini